A very good afternoon and welcome to Pharma Tech. Today we have with us Mr. Kamaljit Behera from IQVIA. Very good afternoon, sir. Thank you for joining us.
Likewise.
So there's been one question that I wanted to ask you, that you have been in this domain of data and analytics from quite some time now. Let's say if India gets that data strategy right, where that keeps India at a position, at a stance compared to the world.
No, that's a great question, and also it comes with a caution that if we get to that point, right? I wish, right, we get to that point,
Yes.
and it's not about only getting a data; it's also getting new possibilities with the
Yes.
data, right? When we have data, we can do something like the population health management, precision medicine. You might be hearing
Yes.
about, right? What it takes for precision medicine to do that. It's all the data, your diagnostic data, your genomics data, your lifestyle data, right? Taking that into. Today, if you ask me, is precision medicine possible in India? Answer is no. But for that, we need that data strategy to be corrected. Last but not the least is it also creates a parallel economy, which of healthcare data analytics, right? I think it's a $1 billion market altogether in US and other nations where we have a pretty good digitization of their data, right? India, think about 1.4 billion of data, right? On that data, a lot of research, simulated research can be done, which and it can just open up the floodgates for us in terms of data analytics, right? Data driven insights and population health management, risk mitigation. It can impact parallel industries that how much premium I'm paying for my insurance will be dependent on how is my lifestyle. My wearable data will tell my insurance provider that okay, this person is little lethargic, increase his or premium, right? Versus someone who is more proactive. So there a lot of changes would happen, right? And the ultimate, I think, would be something called as digital twin concept. Someone was asking me in this conference, right? That is something, right? You think about a day where you are allergic to some gas or some pollens, right? And you're traveling by that. Your digital twin understand the climate that this pollen is there and tells you change the route, right?
Yes.
That's the vision of the future, and hopefully someday.
Thank you so much, sir. It was really insightful. Just a quick question that we as students, somebody who wants to enter into the pharma industry or want to start their career, what are the skill sets they must develop, or the recruiters what they look at from your perspective?
Yeah, I think first of all, because we are living in a very changing or rapidly changing world, right? You should have an attitude to learn, attitude to change, right? And attitude to basically being proactive. That's what I personally look into people, because you can't find a person who has all the skills, right, required for a role in a very shifting world, right? Today, like when I joined, very specifically 10 years, 15 years, 20 years back, like Microsoft Office is a mandatory requirement, like PPT, MS, Microsoft, Excel, other things, right? I think when your job or maybe our kids are going into their job, I don't think things like you should know Python or you should understand. You can't say that this is a black box for me, right? I think having that appetite to learn and be open is the primary requirement. And I think now we should see that right. From a education point of view, we learn something that becomes our foundation, but what all we add to that to complement us, right? I'll give one example. Almost 8 years back, I attended a conference in Boston, Harvard Business Club, right? That was, I think, on AI, where people were still debating AI is a myth or reality, hype versus reality, right? And I was surprised, there were around 300 doctors in that room. And why they were in that room? Because all of them were pursuing some degree or some course on AI. Now think about, they were thinking about that in 10 years back, right? Now I'm really happy that you people, your academics also brings in that amalgamation of a convergence of right data as well as you coming from BDAs or pharmacy, anything. I think that's what the industry needs. So stay focused. In that case, don't lose your domain, right? Domain is your core, and on top of it, you just like cherry picking, right? Something which complement you or you are passionate about driving.
That is definitely something that keep in my mind. Just quick one question. What was your experience at the Pharma Tech?
It was good. I regret I didn't come early, right? But it was good. I think you have put up a good show as well as good speakers. So it is quite a learning journey. I hope everyone is getting back with some knowledge.
Thank you so much, sir.
Thank you.